Ladies, listen up. Millions of women live with endometriosis, often without answers. And oftentimes, women's severe pain during their period is dismissed as something that's normal, but it doesn't have to be just a part of your life. Joining us now live is Dr. Asha Balwal, a professor and OB-GYN with UT Health Houston, to explain symptoms, treatment options, and how women can finally get some help. Doctor, thank you for joining us.
Thank you for having me.
We appreciate it. First of all, let's start with the basics here. What exactly is endometriosis and how common is it?
So endometriosis is a condition where tissue similar to lining of the uterus is seen outside the uterus. So every month when we menstruate, we're also bleeding from this area, which commonly could be in your ovaries, in your bowel, in your pelvic lining. So you get a lot of scarring from that. And it is very common. 1 in 10 women are affected by endometriosis.
Okay, and so this is some signs. Let's talk about some of the signs that a painful period or pelvic pain, you might be passing this off and thinking, well, this just happens every month for me. What are some signs that it actually could be endometriosis?
So pain with your menstrual cycle, which is severe enough that it stops you from doing your daily activities. Like for young girls, you don't want to go to school, or you're taking day off from work, or not having a relationship because you're in that much of pain. It's never normal. And that should really ask yourself to go to see your health provider and speak up about that, these symptoms you're experiencing, so they could be diagnosed early and treated in a timely manner.
Okay, so listen to your body and don't accept that this is just something that you're going to have to live with. There might be real help here. Okay, why does endometriosis go undetected for so long? And if you do suspect that maybe this is me, what should you do?
So endometriosis is a complex condition, and unfortunately, as much as we're doing some work now with awareness and all, like March being the Endometriosis Awareness Month, there's still lack of acceptance that having symptoms like this should be brought into to talk to your provider about that. And the biggest thing over here is there's a delay in diagnosis because the symptoms could be bowel. You think that it's your gut which is causing problem. Sometimes you get chest pain, which is thought that is just some other reason, but it could be endometriosis too. And that's where you have to advocate and talk about the symptoms. Interesting fact is that it can take about 7 to 10 years before somebody would get actually a diagnosis of endometriosis.
Yeah, and I feel like it's so often just because you're having a hard time getting pregnant or something else, and you finally arrive at that and you think, gosh, I could have gotten help a long time ago.
Very interestingly, 30 to 40% of the patients will have infertility secondary to endometriosis.
Really? Okay, and so that's something to ask questions about as well. For someone who has been diagnosed, okay, let's talk about what help and what treatment options are available today. Are there procedures, or is this about managing the pain and the symptoms?
So the treatment for endometriosis is also complex, but it's really individualized, and it's based on your goals as in your fertility, as in terms of your symptoms wise. So there's medications available which helps in terms of reducing the inflammation caused by endometriosis, adjusting your hormones, and then with minimally invasive gynecology approach where you could do small incision surgery using laparoscopy, robotic, you can excise the endometriosis lesion to improve your symptoms and manage your symptoms for lifelong.
Okay, so there is real help out there. So just as we wrap up, first step you should take if you think that this might be you, to try to advocate for yourself and get that conversation going.
My simple message is that your pain is real and you should not have to live with that. So speak up for yourself, advocate for yourself, ask for help. Bad period pain is no such thing. You might have endometriosis and you should seek help for that.
Okay, you are so helpful and really shining a light on this and getting women to have that conversation with their doctors. So Dr. Balwal, thank you so much for coming in this morning. I do want to point out, Dr. Balwal has green pants on.